and what are the links between those two concepts, those two events. Jane Ezerigwe is a law scholar from Nigeria. She will be talking first, and she will be comparing 3 experiences in Nigeria, Kenya, and South Africa, and with a special emphasis on the link between COVID-19 and what happened to food in the local societies of these countries. And then Iris Verhoeyen, who works in Tienen in Belgium, will explain to us what it is to have a stadsakker, a field in the town, for food safety, short chain supply, solidarity, and of course also mental health in times of lockdown. Jane, can I ask you to unmute your Marijke, you want to say something?
Before we go ahead, I would like to get some practicalities on board. First of all, for the people that just joined us, we are on Facebook Live. This session will also be recorded. In case you don't want to be recorded, then please put out your camera. In that case, you won't be recognized and you will be anonymous. Thank you, Xavier.
Thank you, Xavier, for your introduction. And thank you for helping me share my slide. So the title of my presentation is Achieving the Realities of Food Security Imperatives of the SDGs for Africa. And by way of introduction, I'd like to highlight that both COVID-19 and food insecurity are public health problems. But the intertwinement of COVID-19 with socioeconomic factors have affected food production in Africa even before COVID-19. But with COVID-19, it has produced a COVID-19 food insecurity syndemic. And this has resulted to a lot of public health burden. This has required that we try to explore this epidemic or pandemic in its socio-cultural context. And when I talk about food insecurity, I'm going to focus on the physical, social, and economic access to food, and not necessarily on the cultural aspect of food security. Next slide, please. Okay, so I want us to take a look at the situational analysis as per the COVID-19 pandemic situation in these 3 countries, Nigeria, South Africa, and Kenya. In Nigeria, the first confirmed case of COVID-19 was on 27th of February 2020. It was on 5th of March in South Africa and 12th of March in Kenya. I want to highlight that Nigeria has a population of about 208 million people, while South Africa has about 59 million people and Kenya has about 54 million people. However, while Nigeria has that number of population, it has tested the number of samples that have been tested in Nigeria on coronavirus cases are 743,298 samples. But in South Africa, we see a fairly significant sample that has been tested, 5,269,062. In Kenya, we see about 833,000 samples. Out of these tested samples, Nigeria has confirmed cases of about 66,000 persons, while South Africa has about 765,000, and Kenya has about 76,000. So if we look at the number of, the percentage of the number of people that were confirmed from those that were tested, Nigeria has about 12.9% of those that have been tested as confirmed cases. And South Africa has about 14% of those that have been tested to be confirmed to be coronavirus positive, while Kenya has about 9.1% confirmed cases from those that have been tested. When it comes to the number of deaths, Nigeria has about 1,166 deaths as at 22nd of November, while South Africa has about 20,845 deaths, and Kenya has 1,366 deaths. If we look at these countries, we will see that the coronavirus seems to be more severe in South Africa than in Nigeria and Kenya. Can we move to the next slide, please? So, like I said before, food insecurity has always been a problem in sub-Saharan Africa, even before the COVID pandemic. In 2018, the Food and Agricultural Organization had estimated that about 239 million people in the region were undernourished. And by 2019, before the COVID, 1 in 3 Africans was at risk of food insecurity. So we're not saying that the COVID pandemic was what triggered food insecurity in Africa. Food insecurity has always been there. In fact, while the malnutrition rate is to be reduced to 7.5% by 2030, as per the global goals of SDGs, malnutrition has been worsening in every region of Africa except North Africa. And when we look at the regions, we see that there has been severe food insecurity. In Central Africa, is about 32% of the population suffer from severe food insecurity. And in that Central Africa, when you go to Central Africa Republic, it's as much as 58.6% of the population that are suffering from severe food insecurity. However, in East Africa, we have about 32.3% and 25% in Southern and West Africa. So yes, food insecurity has always been there in Africa. Again, we have seen projections that although the food insecurity has been a problem, the COVID has exacerbated the food insecurity as a problem. And before the COVID, it was estimated that about 135 million people could face acute food insecurity by the end of 2020. But with COVID, we're seeing the number rise to 235 million people going to face acute food insecurity. So yes, significantly, we can say that COVID-19, even though food insecurity has been a problem in Africa, COVID-19 has aggravated that burden for Africa. Next slide, please. And so when we talk about the syndemic of food, COVID-19 and food insecurity, we are saying that COVID-19 as a disease burden can aggravate some socioeconomic factors that already predispose Africans to food insecurity. And some of these socioeconomic factors are, in West Africa, we experience conflict and insecurity, especially conflict between farmers and herders. And in South Africa, we have seen severe droughts with 2 devastating cyclones that has battered Mozambique, Zimbabwe, and Malawi in 2019. In Eastern Africa, there has been desert locust invasion. And these factors are combined with the fact that Africa relies heavily on food imports. And with a projection of about 110 billion US being spent on food imports by 2025 by Africans because of urbanization and their population. So because Africa relies on food imports, when COVID-19 came and the logistics, the supply chain was disrupted, this factor, this socioeconomic factor was certainly going to affect the availability and accessibility of food in Africa. Please, next slide. So we'll look at how the COVID has impacted on food insecurity in Africa. Like I said, with the waves of lockdowns and restrictions of movements within and across countries, the food supply chains were disrupted. Again, agricultural inputs and activities were also disrupted. So for example, in East Africa, where there was desert invasion, desert locust invasion, there was a need to distribute chemicals that would help farmers, curtail the invasion. But because there were restrictions on movements, these chemicals could not get to these farmers. There were chemicals in place, but they couldn't be adequately distributed because of lockdowns and restrictions on movement. And then there was also national lockdowns, which limited the availability of street foods. So a lot of urban poor in Africa rely on street foods. They buy they buy food from street vendors. But with the national lockdowns and restrictions of movement, the street vendors were also not allowed to sell food. And a lot of the urban poor who relied on these people to provide them with adequate nutrition could not have access to this food. Farmers also complained that their crops and fruits were rotting due to partial and total closure of markets. So in some parts of West Africa, they were total and a partial closure of markets. And so those that had, for example, the poultry farmers had to have their eggs left with them because they couldn't take them to market. Those that had perishables couldn't take them to market to sell them. And then this resulted in even panic buying, because when the markets were closed up and they were open sometimes twice in a week, people rushed to the market and then tried to do bulk buying, and then this escalates the prices of food for the most vulnerable population. Again, the pandemic increased the price of staple food. According to the market monitor by World Food Programme, the food prices increased either moderately or severely in almost all the African countries. Unfortunately for West Africa, the pandemic came during the crucial months for planting and nomadic movement. So it affected the farmers from going to the farms to plant their products for the next planting season. Next slide, please. So I'll go down to specific examples of how the food systems were disrupted. In Nigeria, millions of informal food sector workers, like I said before, the street vendors, but again, the petty traders were excluded from exemptions when some people were granted exemptions for essential services. Unlike in South Africa, where we saw that most of these informal workers were grouped as essential workers. And for example, grocery stores and informal traders of fruits and vegetables were permitted to open for business in South Africa. They were not allowed or permitted to carry on business as essential workers in Nigeria. But then in Kenya, again, we saw that some of them were exempted from and classified as essential workers. So they carried out partial activities in Kenya. Again, the total closure of markets in Nigeria led to, like I said before, panic buying. But then in Kenya, like I had also highlighted, the lockdown hampered effective distribution of the pesticides to be used to contain the pest outbreaks. In Nigeria, there were allegations of corruption when palliatives were tried to be distributed to the most vulnerable persons. The criteria on who was the most vulnerable person and the the channel of distribution was questioned. But in South Africa, we saw that the seasonal workers, again, when it was obvious that certain amounts were to be paid and food parcels were to be distributed amongst the most vulnerable, some seasonal workers were disenfranchised from accessing these because of some qualifying and assessment criteria that were not necessarily the true situation of things. For Kenya, we saw that the informal labor market was also largely left out when there were tax reductions and refunds. So in general, we saw that while there were interventions and there were efforts by the government to try to lessen the burden of the pandemic on the most vulnerable persons, either the criteria for assessment or allegations of corruption or just neglect of the informal labor market affected these efforts and interventions from getting to the most vulnerable population. Next slide, please. So yes, COVID-19 has ravaged Africa, maybe not as much as it has done in some other Western countries, but then in terms of deaths, but when it comes to the burden on Africa, on food insecurity, it has been enormous. But then it has also provided us with some opportunities. For example, stricter sanitary requirements would now need to be enforced at the abattoirs and cooking outlets, given the increased consciousness on hygiene. So the COVID came with an increased consciousness on hygiene, and people are more conscious and demand for more hygienic environments, especially when it comes to food preparation and abattoirs. Again, the congestion of stalls. So the main reason why the markets were closed down was because the stalls were congested and they were too close to each other, and there wasn't going to be any social distancing measures put in place with that kind of congestion. So it has given us an idea of how to build a more modern market with a lot of ventilation, proper ventilation and spacing for future epidemics. Governments also saw that, for example, in Nigeria, that it became necessary to establish something like a commodity exchange market because during the pandemic, when there were restrictions on movements, some farmers had their products with them, and some other farmers that needed them also had their own products with them, but there wasn't that avenue to exchange these products. But these are some of the measures that are being, or platforms that are being thought about for the future, so that there could be some kind of commodity exchange between and among farmers. Very importantly, home gardens are an important source of food in many countries, and it would be nice for government to encourage people to establish home gardens because with the pandemic, we saw that it was possible for people to be kept at home for 3 days. But when people have gardens behind them, they will find out that they may be able to live these 3 days without so much problems. Next slide, please. So how does Africa begin to bridge the gap in food security global goals? How do we achieve the SDG food security related goals? First, Africa has to and needs to adopt biotechnology. In this case, there has to be the awareness has to be created, the culture has to be changed. A lot of people believe that GMOs and biotechnological products are not good, and there's just a culture of not adopting biotechnology in Africa, and that needs to change. Then capacity also needs to be built so that those that will be able to regulate the safe production of GMOs as per food biosafety the capacity will also be built for them to effectively regulate it. COVID-19 has shown us that we need to build and develop resilient and robust food production systems. For Africa, for example, that relies heavily on food imports, COVID-19 showed us that we have to start thinking intra-African trade and not rely on importing from outside Africa. So an opportunity has been created there where Africans begin to look at trading with themselves as against relying on imports from outside Africa. Like I said, we need to adopt digital and biological technologies. And the COVID-19 also created an opportunity that should be expanded in terms of e-commerce. So with COVID-19, e-commerce, especially in food distribution, was well developed. And this is an option for uptake. Before COVID-19, e-commerce on food was not very developed in Africa, but with COVID-19, it was a sector that was developed. So investment opportunities also exist for those that want to engage in the agricultural value chain. With the implementation of the African Continental Free Trade Agreements, investment opportunities will be opened up in Africa. People will have access to trading in Africa with 1.3 billion people, and there will be foreign direct investments in the area of agriculture. And we hope that this will improve the food security in Africa. Next slide, please. I think that is the end of my presentation. I will be happy to take any questions or make any clarifications moving forward. Thank you. You need to, Xavier, you may need to, we can't hear you.
Okay, I was thanking you. I was saying thank you. So you could read it on my lips, huh? I hope. Marijke, how do you want to go about this? Do you want to first have Iris' presentation and then questions, or do we have questions first?
Until now, I would say we go to Iris' her presentation. In that sense, we have the biggest room for a group discussion. In the meantime, everyone who already has a question for Janie Zerikwe, who I also want to thank for the nice presentation, can already put their questions in the chat box below.
Yeah, excellent. Iris, are you taking over the screen?
Can you see me now?
Yes.
Okay, great. So hello everybody. My name is Iris Verhoeyen. I live in, and I work in Belgium. I will tell you something about the Stadsakker, or city farm in English. So the Stadsakker is situated in Tienen, which is a small city in Brabant, in the center of Belgium. It has about 32,000 citizens, and the Stadsakker is situated between the hospital of Tienen, the OCMW. In English, I think we can translate it as the Public Center for Social Welfare, and near a residential area also, where there are some large apartment blocks and houses. It's just a 10 minutes walk from the city center of Tienen. And we chose this place not accidentally. We really wanted to be close to the city center, and also the services that I talked about, social service and the hospital. De Stadsakker is an initiative of RISO, Samenlevingsopbouw. In English, we call that community development, I think. And at Samenlevingsopbouw, we believe that health is a fundamental right of everyone. A healthy lifestyle and a healthy feeding pattern gives one a greater chance to a higher quality of life, and it reduces, of course, the risk of many illnesses during your lifetime, but also later on when people get a bit older. But we know in Belgium that the greatest cost of families are actually in housing, in energy, so in the heating and electricity, and education, if there are children in the family. And all of those are getting more and more expensive. And during Corona, so during the COVID-19 crisis, we also know that basic food, fresh vegetables, for example, it became more expensive, about up to 10% more expensive in the supermarkets. So what happens when you have a low budget in your family? Well, then you go economize. You economize on the food budget. In Belgium, few people don't have any access to food. But what happens is that they buy less expensive food, and in Belgium, it means highly processed food often, which contains a lot of sugar, salt, chemical preservatives, so it's not very healthy for you. And it brings a low nutritional value. And on top of that, only a minimal part of what people pay goes to the farmer that produced the basic ingredients, and it has a higher negative ecological impact. So that are a few problems that we wanted to address with the Stadsakker. So how does our city farm actually works? I will continue talking and I will try to show some pictures in the same time. Let me see if that works. Okay. Do you see Wannes, the farmer? Okay, that's great. So this is the farmer of the Stadsakker. And so the Stadsakker is I'm translating from Dutch, a social self-harvesting farm. It functions as a CSA project, and CSA stands for Community Shared Agriculture. So concretely, that means that Wannes produces mostly vegetables for the families and the individuals that commit to the farmer for a period of a year. And the farmer, in return, commits to plant and nurture the plants for this community. And the members do the harvesting work, following his indications. They pay a subscription fee, and it's according to their income. So most people pay the standard tariff for us to be break-even. And some groups pay a social tariff, which is a bit more than a third of the standard tariff. So it gets really accessible to most people in Belgium. And some people want us to help us to realize our social goal, and they pay a bit more than the standard tariff. The subscription fees of all members guarantee a free income for the a fair income for the farmer, and it gives him the budget to plant, to pay for the seeds and other material. I'm trying to move on in my PowerPoint, but it doesn't seem to work. Okay. Do you see next image now? Yeah, okay, great. So here you see that it also has an educational aspect, because people learn more about how crops grow when they're ready to come out, the time it takes, the effort it takes also to get in your plate what you can eat. So there is a big respect growing between the harvesters, the members, and the farmer. There's also a social aspect to it. So members meeting each other. Of course, this picture is not taken in 2020. It's just in 2019. So here we have a harvester working on his own, coming to get his vegetables, people bringing their children. So there is also between the families themselves an educational aspect to it. And I will tell some more about this picture later. And come back to you. Okay. Just a second. We have an ecological and organic approach. So we do not use any chemical pesticides or fertilizers. We do not heat our greenhouses. We don't eat them, but we don't heat them. And the vegetables go, as to say, straight from the field to the plate, as we say. And this way we avoid a lot of processing, a lot of packaging, and what we call food miles, so the transportation of the crops. So if we take all of this together, it means that our members are investing in their own good health and in a healthy planet, actually. I just wanted to show one more picture before this one. Will it work? Here. So this is the result of 1 year of CO2 reduction that we have realized altogether. It's 30 tons, 30,000 kilos of CO2. And it means for every member, 167 kilos that CO2 reduction. I've asked Philip, that you see in the picture. I don't know if you see my mouse moving here. Can you see it? Yeah. So this is Philip with his two of his children. He has a daughter too. What does it mean for you to be a member of the Stadsakker? And he says, actually, it's kind of a magical place for me, because I have access to super fresh organic vegetables. They're locally produced, and also as a lot of harvesters, he sometimes helps the farmer, and he sees it's magical to see the plants grow and then later on be able to harvest and eat them himself, while he's not obliged to have his own garden. Anyway, Philippe lives in an apartment, so it's not possible for him to have access to a garden. He doesn't have one. So it's also a bit his garden. When he comes to harvest, he comes very often with the children, and either they work with him or they can also play around. You see there's room here to play around, and there's also a play field. I'll show a picture later on. Last but not least, he says it's also a great way to meet other people. So it might be just when coming to harvest, or when there are activities that we organize. Voila. What you also see are these blue plates here. we put them there because the Stadsakker is open to everybody. It's not just open to our members. I'm moving a bit on to in the pictures, yeah. In Belgium, we have a lot of people having health issues due to a lack of physical exercise. So the harvesting part, of course, is a physical occupation. It's in the open air, which is healthy there. And we also wanted to be open to everybody, not just for the members. So we asked the people living around, what do you think is necessary or interesting for you to have here? And so there's the play field here. We have lots of families coming with the children. People walking around just on the grass. And here you see again these blue plates, which are actually physical exercises, very easy, and you can also make it a bit more complicated for yourself, a bit more exciting if you want a bit more difficulties. And we saw during the lockdowns, especially, a lot of more people coming to the Stadsakker to get profit from just being outside, having fresh air, be able to meet other people, because we have a lot of benches, as you see on the picture here too. So whilst you cannot invite people in your house, it's during certain periods, it's okay to see people outside. So the social and the mental health aspect was important. We had a role to play, and people communicated on it on social media, for example. That was nice to see. So here we see on the left an old picture with the plates. This is an occupational therapist from a local medical center with the group, but now people come alone to do the exercises when they want it. I'm trying to see what else I can add. Yeah, perhaps this part in the spring, as you said, Jane. The spring and summer we also had a drought and heat, and it was difficult for us to start the seeding and planting part of the season. So our farmer also has children, and in the Corona crisis, they couldn't go to school. So we had some difficulties, and we asked members if they could spare some time and come help us, and that was really fun, actually. It was very nuttig, I don't know how we say that, practical. It helped us, it helped the community.
Useful.
Useful, yes, thank you. But it was also fun. I'll show you some pictures. This is later on the season when we harvested the potatoes, children coming to help with their parents. And this person is Anne. I wanted to tell something about Anne. Anne is one of our most enthusiastic volunteers. She got to know the Stadsakker because she spent some time in the hospital, in the psychiatric department of the hospital, which is just next to the Stadsakker, and the occupational therapists sometimes come with the group, and they have a subscription with the Stadsakker too, and they take the vegetables, and then they have cooking activities. And later on, when she got better, Anne asked us if she could do some volunteering, and so first she came one time 2 hours. And now she comes 3 times a week. And she's really moving on in her life. And she tells us that she feels much better in her head, but also in that she feels that she has more energy and that she has physical benefits from coming to the Stadszakker and working with us. So that's really, yeah, satisfying to hear and to see how she develops. And we work quite regularly with some associations in Tienen, because we have a lot of services for psychological vulnerable people, and we try to get them back on track. And so everyone has his own tempo in this, but we have this social approach, not just in a financially way to our social tariff members. Voilà, that's the story I wanted to tell you today.
Thank you, Iris. This is exactly the other end of the scope. Huh? You have the macro view that Jane presented us with 3 countries in a continent, and your story about a small garden in a small town in a small country. So it's interesting to see that there are so many linkages between the 2 stories, and about how solutions can be part of the problem or part of the solution. And that's what's very interesting in this kind of situation. Are there any questions in the chat box? Let me have a look.
Until now, there are not any questions in the chat box. If people want, they can also unlock their microphone and talk directly. But in case there's no question, maybe I can ask one. This one is for Jane. Jane, can you bridge between food insecurity and the limits and the challenges for food insecurity and food systems with health inequalities?
Sorry, I didn't get you.
Could you link, maybe from the context of Nigeria, how food systems and food insecurity link with health inequalities?
Oh, okay. Okay, thank you for your question. I would want to link it by telling you the story of the Almajiri child in Nigeria. So the Almajiri child in Nigeria is usually a male, aged 5 to 18, 19 years, seen on the streets of the major cities in Nigeria, usually begging for food. And so before COVID-19, you'll see them on the streets with their plates. And they rely on passerbys and goodwill of commuters to have their daily bread. People hand them money or foodstuffs, and they deal with that. So unfortunately, during the COVID-19, there were restrictions and there were lockdowns. And so this group of people had to suffer an extra burden on their health, because even though they were one of the most vulnerable persons in the society, the restrictions that came with COVID-19 limited their access to food. They would normally have access to handouts, but they didn't have that anymore. And so they suffered from these extra burdens because of the COVID-19 restrictions. Again, because they were the most vulnerable members of the society who didn't have access to either newspapers or televisions or the care of their parents and guardians who would normally instruct them or guide them on measures to take to avoid contracting the disease, or on their general well-being. and that group of people who usually walk around the streets and could give them some information was also denied. They didn't have access to the measures, social distancing measures, and the hygiene measures that most of us were exposed to that could help us protect ourselves against the COVID. So yes, because they were the most vulnerable people, in the society, they were already they were already socially distanced in the first place. They were socially distanced even before COVID-19. But here again, they were suffering from social distancing within a period of social distancing. And so that's is an example of an inequality that we saw, in Nigeria. Thank you.
If I may, Marijke, I'm struck by the fact that a syndemic is usually described as the combination of two health problems. But here we have, in the COVID epidemic, in the COVID pandemic, we have a situation where we have a combination of the problem, COVID, and of the side effect of the solutions that we put together. It's not exactly as if we can say that malnourished people suffered more from COVID than otherwise. It's just that the measures we put in place to fight COVID increased the risk of malnutrition. And so it's not purely syndemic, as you would say. COVID and diabetes are two health problems that combine to create a bigger problem for the person who has diabetes. But here it's the measures we took. It's not the virus who's responsible for the lockdown. Well, it's responsible of the lockdown, but it's our own measures. It's not a direct effect of the virus itself. So how do you think, and I think we should look at both the speakers today, how do you think, on one side, the Staatsaker helped to alleviate the problems of the measures we took? And how do you think in Africa governments should take measures that are less detrimental to poor people in the situation they are in? I don't know who wants to answer first, but did you get the question?
Yes, I think it's for the two speakers that to answer first, but I might just also want to comment on this, that this really points out social inequalities affecting health and structural violence on health itself, and how much importance we should give on the first line of healthcare, as well as how do we reform our healthcare system. But now I leave the words to either Jane or Iris.
If it's okay, Jane, I'll start. Well, I think the fact that we are so locally embedded is very important. As you said yourself in your presentation, Jane, one of the things that in Africa, but also in Europe, we started to realize is that this dependence we have created of big exportation or importation on food security is not helping us. So as a very local initiative, we saw more people, we saw our members coming more often to the Stadsakker, coming to harvest more often because they had more time. But also, we had this really beautiful example of a man who offered a subscription to his mother to come as a member to the Stadsakker, not just for her to have the access to the food, but also to meet people and to get out. Literally, he said to get out of her house and stay in movement. And yeah, so the fact that we work very locally is actually a way to respond to this dependence of global markets that we have created, and which must not be a dogma. It's not necessarily always so. We can work things out differently.
Thank you. Jane,
Okay.
what have you got to say about all this?
Okay, so my take will be that I'm going to recommend that governments need to take into consideration the socio-cultural realities of their environment when they want to make policies, especially the kind of policies that impromptu and emergency policies that come in a pandemic like the COVID. So for example, Africa has between 65 to 75 of its population employed by the agricultural sector. And so because a significant number of the population in Africa works in the agricultural sector, this fact should have been taken into consideration by, well, it was in some regions of Africa, but in some other regions, this fact should have been taken into consideration when the measures were put in place. So for example, in some rural communities in Africa, and there are a lot of rural communities in Africa, there wasn't so much, it wasn't needed that we should enforce the kind of restriction or movements that we saw in these rural communities. So in some communities, or in most rural communities, you farm or you carry on your farming activities more in a space that we could describe as social distancing. So people are usually not clustered together when they engage in farming activities. Usually people are in an open field, this person in this side of the field and the other person in the other side of the field. So given the true situation of agricultural activities in Africa, it's usually not mechanized, it's usually manual. And so, you like I said, there is a social distancing practice naturally. It wasn't the best to have restricted the move of the activities of these farmers in some of these rural communities. And so this will just be one example of why the government must look at the sociocultural realities when it's making this kind of, it's not enough to say, oh, everybody everywhere in Europe is shutting down. Oh, they are shutting down lockdowns and all of that. You need to look inwards and say, okay, what is good for my people? 65%, 75% of your people rely on agricultural activities, and these activities are not activities you do in a clustered or closed environment. These activities, because eventually it affected the production, the availability of food, and accessibility, affordability, and all of that. And that ends up aggravating the food insecurity in the region. Yeah.
You mentioned that Kenya was different from Nigeria in that respect. That in Kenya, people were not were exempted from exclusion, while in Nigeria they were not. So
yes. So,
do you see in your research a difference between the situation in the two countries?
So unfortunately for Kenya, even though there was a partial, there were few allegations of formerly the government had allowed this group of people, but when it was being implemented, there were also allegations of people harassing some of these informal workers, as the case may be, or trying to extort them. So that was a factor, but at least the government took into consideration the fact that this set of people could be left. But unfortunately, you may not see the effects that you're looking for, because like I said, they were already suffering from low-cost invasion. And unfortunately, even if you were allowed to go to your farms, the fact that low-cost invasion was affecting their productivity and their yields, and the fact that the pesticides were not being effectively distributed, you know, we may not be able to see that difference between Nigeria and Kenya.
Okay.
In terms of, yeah.
Xavier, I also have a question of the public. This relates already a bit to what we've discussed. It's a question about the impact of the collateral effects and the control measurements. They're very, very clear by now, but yet we continue in more or less the same strategy. Is there maybe also, Jane, because you relate more a bit to the meta situation, can you answer on this maybe? The microphone is off, Jane.
Yeah, so please, could you repeat the question? What was your question?
The impact of the collateral effects and control measures. They're so clear, but why do we still continue, and why do governments still continue in the same strategy?
If lessons have been learned, remember COVID-19 was new, was new at all levels. It was something we had never witnessed before. It wasn't easy to have projected that it was possible to shut down almost the whole world at the same time. And so it's easy to make mistakes in such fests. And of course, we've all documented our mistakes. We've all documented what we did right and what we didn't do so right. And so I believe that for the future, it wouldn't be as much as blaming anybody at this point, because like I said, COVID-19 was new. It was totally new and taken at a level that we have never seen. So for the future, for future pandemics, whether as big as COVID or not, lessons have been documented, and that is why we continue to say these things were not done the right way, and we document them for future policymakers, and we will continue to engage policymakers to show them why some of these were not the best decisions. We're not trying to blame people, but we're saying for the future, maybe we should look at this and then look at that. So it will be more like taking lessons down and noting them than evaluating whether it was the right or wrong decision, because it was a new phenomenon. Yes, thank you.
Okay, any more burning questions?
In the chat box, there is no other questions, unless there is someone of the public who still wants to say something.
Okay, it seems everybody's satisfied with the questions that were asked and with the explanations that were given. Thank you very much, Jane and Iris, for sharing your experience. Marijke, you want to conclude?
I'll just give a small conclusion, but with the same as Xavier. Thank you very much, Iris and Jane. I think it's been really interesting to see both the micro aspects as well as the meta aspects of how governments, but also how social society groups and civil society groups can make a difference. And this happens both in Global South as in the Global North, and how also the relationship between health inequalities and social inequality, economic inequality, and structural violence are very, very prominent during this time. Also, I would like to everyone thank for listening and coming to this webinar. It's been a very interesting session. As Xavier has mentioned before, we will continue in our working group Determinants of International Health with subsequent webinars, which will follow in the beginning of next year.
Thank you very much, everybody. Have a nice day further on, and see you in the next webinar.
Thank you, everybody.
Bye-bye.
Thank you, Jane. Thank
Thank
you.
you.
Bye.
Yeah.
See you.
See you. Bye.